So good morning. Wonderful to stay here and to be here. After such a long period of time again on the Pharma stage. So I'm really grateful. And it's also wonderful to see people whom I haven't seen for ages and even able to hug them. That's just a wonderful thing to be. And when Dario actually asked me, it was probably a little bit more than 1.5 years ago, we were in the middle of the full craziness. So I couldn't make it to an online event even. I would have loved to, but I kept him the promise, given the promise. If you invite me again, I come back, but I come. And thank you, I'm here. I'm wearing the band, so I have that too. So thanks a lot. Unfortunately, and you see here still Alexander on it. Alexander couldn't make it due to personal issues, and which is a real pity for me because actually the both of us wanted to be here and show collaboration effort because everything what we did was just about collaboration. That's a pity anyway. He sends the best regards and hired him actually as the first person for the local affiliate. So that's even more so a pity that he is not with us today. But anyway, I do my best to replace him. And I don't need to explain this icon, so it says it all. The global pandemic, we were in the middle of everything, as you know. And we saw in the beginning a short video, and I would actually approach it differently. If you think about the last 2 years, every one of us has his own pictures in his mind. Whether it's the Italian army, military trucks on empty streets anywhere else, families, daughters, sons, kids, grandmas, grandpas whom we couldn't see, people, losses, severe diseases, lots of different things, Teams, Zooms, we all heard it today, even toilet paper. There's so many things which affected us. Imagine now being in a situation that you feel you maybe can do something about it. And suddenly you're in a company where there's hope and you can really, where you know, if it works, we can really make a difference and we can really change. And if not this purpose, what purpose do you really want to have? And I've been in oncology since quite a while and have been able to work on wonderful brands, but that purpose was really incredible. And that was something which really made a lot of these things happen and drove us. I would like to focus on 3 things today, 3 elements. Lightspeed, I just touched briefly. Then talking about the commercialization in Germany is one of our commercialization territories. I will not talk about global here and talk about healthcare 4.0, which more or less discusses commercial or commercialization 4.0 primarily. And you know that all. I mean, you probably recall the genetic sequence of the spike protein. The antigen was actually published on the 12th of January. So quite a while ago, beginning of 20. And on the 1st of December, in the same year, in the UK, we got the emergency authorization for the vaccine. So an incredible speed. No one really thought it was possible. We'll not discuss this in more detail. I just want to give you the perspective and now imagine what that means for commercialization and for all other functions. Because if they do it, you have to do it as well, so you just cannot wait. So that was really a big drive on our side. Project Lightspeed, by the way, was a name which was given to the program in the very beginning. So actually, Ugo called it Project Lightspeed, our CEO, a couple of weeks later. So that was actually before the whole thing, so Lightspeed didn't come afterwards as a name, just as a comment on the side. And it was all about collaboration. I mentioned it in the beginning. So institution authorities, regulatory authorities, governments, associations, healthcare associations, patients, vaccines, whatever. An enormous collaboration effort, and of course, great partners. So without Pfizer, and we also need to be very clear about that, we would not have been able to make this happen. Bring up development programs at that global scale, also commercialize globally, and have the manufacturing capabilities set in the way they were really set up. And that led us to 3.4 billion doses shipped until today. A little bit more than 3.4 billion doses. More than 175 countries worldwide. Quite an effort. And how did this feel in Germany? In one of our commercialization territories, we had a special agreement here with Pfizer, how we set it up, and we had the accountability for our country. Home country, very special. You can imagine if you have everyone really observing you, that's quite a pressure. So you not only have your CEO and your teams there, but you also have the investors, the stakeholders. You have lots of people there, so it was pretty intense. But that's how it started on the 20th of August in 20. So we had nothing. So there was no function existing. So actually, it was, on the 20th of August, the signature was established, and I actually put the signature on paper. So this is how the whole journey started in Germany. Just in a few weeks, we put up an infrastructure together with a lot of external people, as you can imagine, because you can't hire people that quickly. And already on the 21st of December, we got the approval via email. On the 27th, the first person was vaccinated in Germany. So Edith Quasella was the first person who was given the vaccine, and only 3 months, a little bit more than 3 months later, we had to launch in a decentralized fashion. So we had a further launch. I will get back to that in a second later, for 120,000 physicians. We implemented Salesforce a month later, and then had our first big congress in the country as well. And you see that short period of time, and please recall that when we go through the other stuff later on. So that's really critical. It really happened in just a very, very few months. And I want to bring you back to this moment because there the intensity of Lightspeed was the biggest. After that, things were a little bit different. Using the same models, we heard that before, people, process, technology. So we saw that model based on science, based on data. Also on the commercial side, we built everything for data. And that was the only possibility, that is the only possibility, and was for us the only possibility to scale up, to automate, and of course also keep up with innovation on the digitalization, on the digital side. And of course, in the middle of everything, stakeholder centricity, and we're talking here about customers, we're talking here as well about the employees. Also them we included, and when I mention data, I mean we really put everything, or we try to track everything what we do organization-wide with data, and fit it in, including surveys, feedback loops, what have you, in a 360 environment. So the healthcare 4.0, what does it really mean? There were a couple of things which we did consider, and one of them was really the focus on quality. Again, as you can imagine, if you work in your home market, you need to be even more specific and focus on the things and high quality because everyone is observing you. But on the other side, we're talking to so many people, and media was so active that was the only solution. I didn't want to make a single mistake as well. Connected print, we mean digital and print connected. The German market is a very decentralized market and still very focused on print. Even fax, we heard it from Jochen before. Integrated training, external and internal, smart digital structures and approach, which really took from the very beginning onwards. And keep in mind, when we started that, we had a green field, so there was nothing. So even there, and that's referring to the change management discussion before, we didn't have a transformation, we had a build-up. So there was no clear change management needed because we just conceptualized and then started to build. And with the starting of the build, we already were in the building mode. And machine learning, a couple of other things which were critical for us. And I'd like to use a video and guide you quickly through a video and give you a flavor how that actually felt. So decentralized launch, there was something which the government asked us, and this is July last year, so which the government asked us to move towards after the pandemic launch pretty quickly, to approach 120,000 customers in different ways, not going via the vaccination centers, because the building was with the 450 vaccination centers in the beginning, like in other countries. And that was really critical. Also targeting the 20,000 pharmacists, and really take a completely different approach. You can imagine that we had to change everything, because in the beginning, we shifted to the government took it all, we just had to deal with big structures. But keeping up to speed with the relevant information and with changes on an ongoing scale. So up to now, we have way more than 100 variations in the SMPC. So you can imagine how often you have to change things and had to change things. Typically, omnichannel approach, including everything, again, including fax for our German colleagues. So I would say the standard setup, but built from the beginning onwards. And that was the nice thing and the nice opportunity we had. We built typical standard detailing aids, and you can see them in a second. This is a shot from a local campaign, which you used here with real scientists, detailing aids for the salespeople we've used in a standard fashion. Built also newsletters, and they were really critical, addressing with newsletters each and every one because of these ongoing changes. And you see them here illustrated nicely. And well, they were all linked in the overall concept. We had 7 websites being launched, all in Germany. We're talking only about Germany here. So 7 websites, unbranded, branded campaigns. You see a screenshot or an extrapolation of an illustration of the standard product website. The handling videos, of course, very critical. Can imagine how much that did cost and investment and education, because you know the vaccine in the beginning was not the easiest one to handle with. A web shop which we built in You saw we also had a chatbot ongoing in the very beginning already. You see them also on the website. If you go to the website, you can see them, build them in all of the websites. Posters linked in with QR codes. And that sounds generic, such a simple QR code, but in that framework, in that time, it was really critical because people couldn't touch anything. So when someone visited a physician in the practice and was in front of a poster, that was really critical that you also could have this extension. Unbranded campaign, which helped us to explain also mRNA on a broad scale. Webinars, and webinars was a critical tool. They sound also pretty easy. I'll come up with the figures a little bit later, and you will see how intense we could handle them. We had everything in multiple languages. Here you see an illustration of the unbranded campaign with the mRNA Verstehen, so the mRNA Understanding campaign. And last but not least, the critical one, feedback. Feedback loops, whatever we did and wherever we built anything in. That was for us super critical that we have these feedback loops, because otherwise you don't have the data. So you can say we need data, we push for data, but if you don't have them, then, or if you don't make them, produce them, then you wouldn't see them. So skip now this part and let me show you figures. And I felt I'm here in front of experts. So what you want to see is just data. And again, put yourself back into July last year, because that's what I really want to give you this snapshot. That's a different one than it would look today. This really shows you the intensity. And you know what these figures means. Almost 10 million materials, published materials, or printed materials in a country like Germany. I mean, normally, when I worked in oncology, I print a couple of hundred folders, or a couple of hundred pieces and leaflets and whatever kind of special devices, but definitely not this kind of materials. You also have to imagine with this level, you need to be very consistent with information. Of course, we always need to be consistent, but with the changes, even more so critical. In 12 languages, again, talking about Germany, including language for blinded people, so in the Braille language, 73 QR codes last year, July. We reached with the websites 1.1 million HCPs, 45,000 downloads, 8,008 downloads for apps. We also had a BioNTech external app. We also had an app specifically linked to the websites or built according to the websites. And a number which is incredibly important here is the number of the consents. So everyone knows how difficult it is to get customer consents. We had 37,000 in 3 months. So of course, we had a big driver. There was a reason for it, but anyway, that was the status just last year. Of course, it's in the meanwhile way more. 36 webinars, 42,000 participants, so an incredible number. I always said to myself, hey, I'd like to sit in in front of a couple of thousand people. That was a joke in the beginning, but we really made it. So we had to max 55,000 people in one of the webinars. 23 different topics, bigger or larger topics, almost 10,000 questions submitted and answered. And then a core of the whole thing, the service center. So what stands here behind service excellence is talking about the help desk or the service center, where we had 60 FTEs working for us. We had one virtual agent, which we needed because of the influx of massive information which came in and the need. That was the only solution to cope with that. And we answered actually 60,000 emails and calls up to then. On the machine learning side, and you saw Edward before, our chatbot, that's one of them. We have 4 assist applications which dealt until that point in time with 500 inquiries a day. And if you now make the numbers, you know what that could mean in terms of FTEs you would not need. That's actually behind it, and that's a critical thing that this really works. And I can only say on our side it really worked. Of course, we had also physical employees. Detailed questions are not, you need people behind it, but in any case, it helped us, in any way it helped us enormously to deal with here what you see, the 62,000 messages. And even more important, again, we did the data and the analysis and really wanted to look into and check what that really means in terms of quality. I mean, talking about quality is nice, but if you don't measure it, it doesn't mean that much. So we did that too, and the connected print and all these tools had design ratings and information rating in the range of 90%, Recommendation rate 84%, also very high. And an impressive number is the 25% of the QR codes. This is why I pointed out the QR codes before, because I've never seen a 25% response rate. Of course, again, pandemic was a driver, but anyway, it did work. So this is just something which I really want to explicitly point out. The net promoter score for the website, 88%, also substantial. And the number I found really stunning is 3 minutes and 47 seconds for people remaining and staying on the website. So that's also, I would say, a pretty decent number. So the information at least seemed to be okay. So that worked extremely well. We had 5% of opt-outs, 85% of user returns. When we're talking about the education, that's here focusing on external education, the top mark, the net promoter score of 82. We have pretty much the same numbers also for internal experience here with education, with the programs for salespeople, but they're not here. And service excellence, we did and we put quite some effort in really in checking that, and had mystery calls, mystery emails, mystery contact, mystery approaches via any possible solution, really to check how the work is done and to check the quality of the help desk. 150 a month, or 150 of that a month, with 86% in terms of quality above the rating. So quite substantial benchmarks. And it helped us to improve continuously on the help desk. And you can imagine if you ramp a help desk up with 60 people, you need to check that really regularly. And also, 90% of the questions could be answered, or more than 90% of the questions could be answered within a day. 11% when I'm talking about machine learning return rate, 45% comprehension rate on the interaction. So machine learning, really a critical element which we're focused on. So last but not least, a third element, what did we do afterwards? And that was that's a really critical thing which we did last year. So we started it in actually at the end of March last year, and we built 8 enterprise solutions, or implemented eight enterprise solutions until the end of last year. In December, end of December, 31st of December, this was the outcome. And just to illustrate it, you see here master data management, customer relationship management, business intelligence tool, the multi-channel marketing system, content management system, digital asset, learning experience, and customer care tool as well. So when you look at these, so I would say the standard range, so nothing really fancy, but the standard thing which you really need if you want to look into the future and want to build for the future. And to illustrate it even more so that you really believe me, because that looks now nice, but it's still a graph, I want to highlight CRM. Every one of you knows how the stories about the CRM and how difficult it is. I mean, the big rollout come. You see, within a year, it's actually pretty decent if you're done in your country. 6 months, it's pretty fast, almost damn fast. If you're a little bit fast, it's even incredible. We did it in 6 weeks. And jumping one back, I'm talking here about greenfield, and I'm talking here about best of breed. Everything what you see here are not just systems. We did it everything according to Gartner and Forrester ranking and selected really the best of the best. So we said, if we do that, we do it right. So also for CRM, there are 2 big companies out there, and you know them all. And we have one of these 2 companies, and we did it with the company in 6 weeks. The RFP was done on the 23rd of March, 20. The next day we started, and in the second week of May, when the sales force came in, we trained the sales force with the CRM system. So hard beginning, hard stop. So the 6 weeks are really true. Of course, we didn't have it, and it was new, but still, it's something which is nice to tell that you see and how fast you could be. You can also imagine how the discussion was when we told the company, this is what we want. Of course, we got pretty interesting feedback, but at the very end, we succeeded and made it happen. So these are just illustrations, nice dashboards for incentive models, a couple of really interesting things. We also use voice recognition to document calls for the sales rep. A couple of fancy things, I skipped them. E-mobility, you saw it before. Our plan for the future is to build the tools for the car and not take the car and then do what we can. This is, of course, the next step, but that's just forward-looking. But at the very end, and let me really finish with that because this is for me really critical, it's all about people. We heard it also from Davidek today. It's really all about people. You can imagine that was not an easy journey for no one in the journey, and it still is not an easy journey. It requires special people, as every company does. From our side, accountability and empowerment are for sure one of the two critical things, in particular in the beginning. And let me also highlight that you see, we did it with a handful of people. So the first pandemic launch is also important, just looking into Germany with a handful of people, but you can imagine the external power which was behind it, and to manage that, you needed to have a lot of empowerment and accountability to do so. Decision making incredibly fast. The better the data, the faster you are with the decision making. Flexibility, don't think I need to discuss this in detail. Solution-oriented is something which our people should have in their genes, and it's for us extremely important. And last but not least, we have 12 seconds, and I'll take the 10 seconds here. Again, it's the purpose. And we don't have the purpose. If we haven't had this purpose, this would not have been feasible. And with that, last second, thank you for your attention.